The act of maintaining a clean and orderly home is generally considered a cornerstone of personal health and hygiene. Yet, public health reporting now highlights a counterintuitive and potentially lethal risk hidden within a common household chore. For many, the simple task of dusting an attic, sweeping out a garage, or tidying a long baz shed involves the use of a dry cloth or a standard broom. However, medical experts and epidemiological surveillance teams are warning that these specific tools, when used in environments where rodents have been present, can act as a delivery mechanism for hantaviruses. This group of viruses, predominantly carried by various species of mice and rats, represents a significant zoonotic threat that bridges the gap between the natural wilderness and domestic living spaces. While the presence of rodents in a home or outbuilding is often viewed as a mere nuisance or a structural concern, the biological reality is far more clinical. The virus is shed through the urine, droppings, and saliva of infected hosts, and while it remains dormant in these materials, it does not remain inactive. The primary danger to human health arises when these dried materials are disturbed. The use of a dry cloth or a broom creates what scientists describe as aerosolization, a process where microscopic viral particles are kicked up into the air and suspended in a fine mist of dust. In this state, the virus is easily inhaled, bypassing the body's external defenses and entering the respiratory system. Understanding why this matters requires looking at the broader landscape of global public health. Hantavirus is not a single entity but a family of viruses with different strains appearing across nearly every continent. In the Americas, the focus is often on Hantavirus Pulmonary Syndrome, a severe and often fatal respiratory disease. In Europe and Asia, different strains are known to cause hemorrhagic fever with renal syndrome. Regardless of the specific geography, the common thread is the high rate of severe outcomes and the relative rarity of the disease, which often leads to delayed diagnoses. Public health agencies emphasize that while the total number of cases reported annually may be low compared to seasonal influenza, the mortality rate is disproportionately high, often exceeding 30 to 40% in documented pulmonary cases. This makes every potential exposure a matter of serious clinical concern. The framing of this issue is not intended to incite panic, but to foster a more informed approach to domestic maintenance. The transition from a routine cleaning task to a medical emergency can happen in a matter of seconds, driven entirely by the physics of dust and the biology of the virus. As we examine the core developments in how this virus is tracked and managed, it becomes clear that the suicide tool metaphor used by some health commentators refers to the inadvertent self-exposure that occurs when individuals lack the necessary information to handle rodent-contaminated areas safely. This report will detail the mechanisms of infection, the current state of surveillance, and the specific protocols recommended by global health authorities to mitigate a risk that is literally in the hands of the public. The clinical and laboratory investigation into hantavirus transmission reveals a complex interaction between environmental conditions and viral stability. Once the virus is aerosolized through the use of dry cleaning methods, the particles enter the human lungs, where they target the endothelial cells that line the blood vessels. This triggers an intense immune response, leading to what clinicians describe as capillary leak syndrome, where fluid begins to flood the lungs, making it increasingly difficult for the patient to breathe. Public health labs and diagnostic centers emphasize that the window for effective intervention is narrow. The early symptoms are notoriously nonspecific, often mimicking the flu with fever, muscle aches, and fatigue. This creates a significant challenge for surveillance agencies, as patients may not seek help until they reach the cardiopulmonary stage, characterized by sudden and severe shortness of breath. Medical facilities in regions where hantavirus is endemic maintain high levels of suspicion when these symptoms appear, particularly if the patient has a history of cleaning or working in rodent-prone environments. The diagnostic process typically involves specialized blood tests to detect hantavirus-specific antibodies or the presence of viral RNA through polymerase chain reaction, or PCR, testing. Because these tests are often centralized in high-level reference labs, the logistical turnaround time can be a critical factor in patient outcomes. In terms of global surveillance, Agencies such as the Centers for Disease Control and Prevention and the World Health Organization monitor rodent populations and environmental shifts that may lead to mast years, where an abundance of food leads to a spike in the rodent population and a subsequent increase in human risk. Research into the shipping and travel sectors has also highlighted how hantaviruses can be transported across borders via stowaway rodents in cargo containers, though the primary risk remains localized to the immediate environment of the reservoir host. There is a persistent tension between verified clinical data and the public's perception of risk. While some may view the danger as confined to rural or wilderness settings, data from suburban and urban health departments confirm that hantavirus does not respect property lines. Any structure that provides shelter and food for rodents, from a luxury suburban home to a city warehouse, can become a site of infection. The core of the current reporting focuses on the specific danger of dry methods. When a dry cloth is used to wipe a surface contaminated with dried rodent urine or feces, the friction does not just remove the dirt, it breaks down the organic material into respirable particles. This is the critical development that health officials want the public to understand. The virus is not just on the surface, but potentially in the air you breathe while cleaning that surface. The lack of a specific antiviral treatment or a widely available vaccine for most hantavirus strains underscores the importance of understanding these mechanics. Hospitals and clinics can offer supportive care, including mechanical ventilation and oxygen therapy, but the physiological toll on the body is immense, and the recovery process can be long and arduous for those who survive. Prevention and public guidance remain the most effective tools in the global strategy against hantavirus, as the limits of medical intervention are well documented. Health authorities have moved away from general warnings toward highly specific protocols designed to prevent aerosolization. The primary directive is a total shift from dry cleaning to wet cleaning methods. Officials state that if you encounter rodent droppings or nesting materials, you must never use a vacuum cleaner, a broom, or a dry cloth. These actions are guaranteed to loft viral particles into your breathing zone. Instead, the accepted protocol involves the use of a disinfectant, most commonly a 10% bleach solution. The guidance is to thoroughly soak the contaminated area and let it sit for at least 5 minutes. This serves two purposes. It inactivates the virus and weighs down the particles, ensuring that when they are eventually wiped up with a paper towel, they remain in a liquid state rather than becoming airborne. Furthermore, personal protective equipment, such as gloves and in some cases, high-efficiency particulate air or HEPA filter masks, is recommended for anyone tackling a significant cleanup task in an enclosed space. Increasing ventilation by opening doors and windows for at least 30 minutes prior to starting the work is another simple but vital step in reducing the concentration of any potential viral mist beyond individual domestic actions. Public health surveillance continues to grapple with the uncertainties of environmental change and its impact on zoonotic diseases. While we understand the primary reservoirs, such as the deer mouse in North America or the bank vole in Europe, the precise timing and location of outbreaks remain difficult to predict. This uncertainty places a heavy burden on public education. Guidance is not just about cleaning. It is about rodent-proofing homes by sealing entry points. It's managing food sources and maintaining a perimeter that discourages nesting near living quarters. In the professional sector, labs continue to work on potential vaccines and therapies, but for now, the most sophisticated defense we have is the application of basic physics and chemistry in our daily lives. The transition from a dry cloth to a spray bottle of disinfectant is a minor change in routine that can have a profound impact on public health outcomes. As we close this report, the message from the health community is clear. Awareness is the first line of defense. By acknowledging that a common culture can carry a hidden biological risk, and by adopting the wet cleaning protocols endorsed by global agencies, we can significantly reduce the incidence of this severe and preventable illness. For more in-depth reporting on public health developments and global surveillance, consider staying tuned to this channel as we continue to track emerging medical trends. The clinical evolution of a hantavirus infection is a multi-stage process that presents a formidable challenge to even the most sophisticated diagnostic facilities. Public health agencies categorize the progression into distinct phases, beginning with an incubation period that can last anywhere from 1 to 8 weeks. During this initial time frame, the virus remains silent as it replicates within the host system. Once the prodromal phase begins, patients typically report a constellation of non-specific symptoms, including high fever, severe muscle aches, particularly in the large muscle groups of the thighs, hips, and back, and profound fatigue. In laboratory settings, this stage is characterized by a significant drop in platelet counts and the appearance of atypical lymphocytes. Though these markers are frequently mistaken for other viral illnesses, like seasonal influenza or early-stage pneumonia. The reporting from regional medical centers emphasizes that the lack of specific diagnostic indicators in the early days of infection often leads to a dangerous delay in hospitalization. It is only when the patient enters the cardiopulmonary stage, often occurring abruptly 4 to 10 days after the initial symptoms, that the severity of the situation becomes undeniable. At this point, the virus has successfully compromised the integrity of the endothelial cells lining the pulmonary capillaries. This results in an unprecedented leakage of plasma into the alveolar spaces of the lungs, leading to acute respiratory distress and, in many cases, cardiovascular collapse. The laboratory response to these cases is governed by strict biosafety protocols, as hantaviruses are handled in high-containment environments to prevent secondary laboratory-acquired infections. Diagnostic verification relies on a two-pronged approach: serological testing to detect specific IgM and IgG antibodies, and molecular testing via polymerase chain reaction, or PCR, to identify viral RNA. Public health surveillance data indicates that while these tests are highly accurate, they are often centralized in state or national reference laboratories, creating a logistical bottleneck that can delay confirmed results by 48 to 72 hours. This necessitates that clinicians in high-risk areas make treatment decisions based on history of exposure rather than waiting for definitive lab confirmation. The surveillance aspect extends beyond the hospital walls to the ecological monitoring of rodent reservoirs. Agencies like the Centers for Disease Control and Prevention and international counterparts track environmental variables, such as rainfall patterns and food availability, which lead to mast years, periods where an explosion in the rodent population directly correlates with a spike in human infections. These agencies employ field biologists to conduct routine trapping and sampling of rodents to determine the localized prevalence of the virus, providing an early warning system for healthcare providers. The contrast between verified scientific data and public perception is most evident in the domestic cleaning context. While many view a dry cloth or a common vacuum cleaner as effective tools for sanitation, mechanical testing in aerosol labs demonstrates that these devices are highly efficient at dispersing particles between 1 and 5 microns in diameter. Particles of this size are small enough to remain suspended in the air for hours and, more critically, are small enough to bypass the upper respiratory tract and settle deep within the alveoli of the human lungs. This is why the metaphor of the suicide tool has gained traction in public health messaging. The very tools used to tidy a space are the tools that maximize the viral load delivered to the operator. Furthermore, the stability of the virus in the environment remains a subject of intense study. While hantaviruses possess a delicate lipid envelope that makes them susceptible to common disinfectants, they can remain viable in dried rodent excreta for several days or even weeks, depending on temperature and humidity levels. This persistence means that an attic or storage shed remains a biological hazard long after the rodents themselves have vacated the area. Surveillance reports also highlight the risk in the shipping and logistics sectors, where rodents may nest in cargo or shipping containers. While documented cases of transcontinental spread via trade are rare, the potential for hitchhiking rodents to introduce new viral strains into naive environments remains a point of concern for international health regulators. Hospitals in endemic regions maintain high-level isolation units and extracorporeal membrane oxygenation, or ECMO, capabilities to treat the most severe cases. But the core of the medical consensus remains focused on the fact that once the respiratory failure begins, the clinical outcome is largely dependent on the patient's underlying health. and the speed of supportive intervention. The transition from understanding the biological risk of hantavirus to implementing effective prevention requires a fundamental shift in how the public approaches domestic hygiene and environmental maintenance. Public health guidance, issued by organizations such as the Centers for Disease Control and Prevention and the World Health Organization, is explicit. In any environment where rodents are suspected to have nested or traveled, traditional cleaning tools must be sidelined. The primary takeaway for residents and property managers is the complete avoidance of dry cleaning methods. This means that brooms, dusters, and standard vacuum cleaners are deemed unsuitable for these tasks because their mechanical action is specifically designed to agitate particles. A vacuum cleaner, for instance, draws in air but often exhausts microscopic particles through its filtration system, effectively acting as a dispersal device for any viral load present in the dust. Instead, the gold standard for hantavirus prevention is the wet cleaning protocol. This begins with the application of a disinfectant, most commonly a solution of 1 part household bleach to 9 parts water. Health officials emphasize that the contaminated area should be thoroughly sprayed until it is saturated, ensuring that no dust can become airborne during the subsequent cleanup. A critical, often overlooked step is the dwell time. The solution must sit for at least 5 minutes to ensure the virus's lipid envelope is chemically deactivated before it is wiped away with paper towels or disposable cloths. Practical safety also extends to the personal protective equipment used during these procedures. For significant cleanup efforts in enclosed spaces like basements or attics, health departments recommend the use of rubber or plastic gloves and, crucially, a properly fitted N95 or HEPA-filtered respirator. While a standard surgical mask may provide some barrier, it is often insufficient to filter out the microscopic aerosolized droplets that carry the virus. Furthermore, ventilation is a vital, non-negotiable component of the safety strategy. Before beginning any work in a long closed space, the protocol dictates opening all doors and windows to create a cross breeze for at least 30 minutes. This allows any existing airborne particles to dissipate and reduces the concentration of potential pathogens. The broader strategy of rodent-proofing serves as the final layer of defense. Public guidance follows a seal-up, trap-up, clean-up methodology. This involves identifying and closing any entry points larger than a 1/4 inch, using materials rodents cannot chew through, such as steel wool or metal flashing. By removing food sources and potential nesting materials from the perimeter of the home, individuals can significantly reduce the likelihood of a viral reservoir establishing itself in the first place, despite these clear guidelines. There remain honest limits to our scientific knowledge and clinical capabilities regarding hantavirus. Surveillance agencies acknowledge that while we can track the presence of the virus in rodent populations, we cannot always predict when or where a specific human spillover event will occur. Furthermore, there is currently no specific antiviral treatment or widely available vaccine for Hantavirus Pulmonary Syndrome, leaving medical teams reliant entirely on aggressive supportive care. This reality places an ethical weight on the shoulders of the individual. The responsibility to maintain a safe environment is not just a matter of personal health, but a contribution to broader public safety. An informed citizenry serves as the most effective buffer against zoonotic diseases that thrive in the shadows of neglect or misinformation. The suicide tool of the dry cloth is replaced not just by a spray bottle of bleach, but by the application of rigorous, science-based caution.